to highlight the plight of many of the civilians that live in the northern part of Ethiopia, in Afar, in Amhara, but also in the Tigray region more generally. The situation is indeed getting from bad to worse, and it's important to highlight the impact of the humanitarian suffering of so many people today across that region.
You spoke about silencing of guns. Are the guns now quiet?
I can confirm indeed that the peace has come back to northern Ethiopia. I was just there. I came yesterday from Ethiopia. I did a tour of our structures, our projects, our partners, and I can indeed say that the cities of Mekele, Shire, and many parts are indeed resuming their life. It doesn't mean that life is back with quality outputs, with the right social services for people to maintain and remain there, but I can say indeed that the impact has been quite colossal in terms of silencing the guns, providing some hope for the population. People are in the streets as opposed to a few months back where our teams had reported that the city was completely dead and sealed. And hence, I think the impact is first and foremost important on people to feel secure, to feel they're able to move out of the region, even into the capital itself. But the dividends of that peace are still to be seen. The impact of 2 years of armed conflict has led millions of injured, of internally displaced, but also of those who were separated because of the war, still needing very much assistance, aid and help from all of us, including the international community.
What must be done to address the challenges on the ground in Tigray?
Ma'am, first and foremost, I think we need to acknowledge that the authorities have granted access to all organizations. It's true that humanitarian access to remote areas, to the rural areas, is still a little bit complex because of several reasons. We've been accessing all areas, supporting health facilities, and I think that notion needs to be revisited by so many who still claim that access is not ensured. I think there will be, as we move forward, more done by the authorities, like, for example, the resumption of all the social services, because today I can easily say that health services are in deep trouble. Again, the effect of 2 years of war has led hospitals to be either closed, looted, destroyed. I visited one of the the primary healthcare centers that we constructed a few years back that indeed is dysfunctional today. The leadership of states like South Africa, indeed to honor the commitments to find African solutions to African problems, where the ICRC has been acting as a neutral intermediary, but also as an actor on the ground. We have unfettered access. We've managed indeed to bring as much humanitarian assistance, but as I said, and with due honesty, much needs to be done yet.
You spoke about the challenges in relation to health sector. Is the World Health Organization assisting, particularly when you look at the director of the WHO? He comes from that region. Have you tried to check with the WHO what they can do to assist?
So as you know, ma'am, we're a humanitarian organization. We need to learn how to swim in the sea of politics without really getting involved in businesses that we have no intention to get into. Politics is indeed way beyond our remits, yet indeed in terms of coordination and bringing the voice of those voices today in the regions of Afar, Amhara, in the Somali region, but also in West Oromia and in Tigray, is an essential component of our work. We do reach out to all humanitarian organizations, namely the World Health Organization, because of the needs in the humanitarian sector. I want to say that we are proudly also working with the Ministry of Health, where we've been facilitating the delivery of tons and tons of medical assistance, of dialysis reagents, of surgical capacities, We've flown, since the signing of the peace agreement, over a dozen of flights with full of medical items. I've visited Aider Hospital as well as the Awash Military Hospital, where there are thousands of war wounded and people needing assistance. And I think way more needs to be done in consultation with the authorities, because first and foremost, there is the responsibilities of the parties to the conflict to get there. And meanwhile, because of the criticality of the situation, the ICRC is extremely proud to do and perform its mandate. Hence, the output that was provided by our teams, and especially also by the Ethiopian Red Cross Society, that has the biggest network of volunteers across the country, has been extremely useful to bring some normalcy for those who need it. Now, I also have to confess that the health situation is one of the most dire in this conflict. The needs are immense. Our orthopedic centers, so the physical rehabilitation centers that would fit people who've been amputated because of the war, because of the leftovers and unexploded remnants of war, has been colossal. The waiting time is probably a year for a new patient to be fitted. So you can imagine the number of and the distress that has caused, and this will take some time, but with the right surge and with the right actors and expertise, I'm sure we would all carry this challenge together.